Okay, I wanted to share some final thoughts that I have with our post-op protocol for scoliosis and kyphosis correction surgery. Hopefully you've gone through all of the phases. Maybe you're in advance looking at the other phases and you're getting to this concluding video before you're actually at a year. But either way, congratulations on being proactive on your health, being proactive on treating your back and getting yourself the best recovery possible after the surgery. So very important. I think a lot of people downplay how important it is to really get specifically back to doing things that they were doing before. And so I applaud you for sticking in there and going through this protocol and visiting this website that shows that you are committed to your health. A lot of times when I see especially adolescents that have fusion surgery for kyphosis and scoliosis, they're not referred for physical therapy. And most of them do fine, but I tend to see the ones that don't do fine 6 months after, a year after, 2 years, even 10 years after or more. I'm the one that gets to see those that are still having pain at that point. And there's a lot that we can do for those, even though it's been that long, but we could have done so much more and had faster results if they had come in sooner. So if you are having some lingering pains, some aches and pains that are not going away, if you're having numbness and tingling around your shoulder blade, or you feel like your neck is just tight, or your posture, you can't really get your posture back and your shoulders are having difficulty with that, and especially if you have a curve still that wasn't fused, so maybe they did a selective fusion where they fused thoracic and didn't lumbar, or something similar to that. There are a lot of things that we can do to help reduce progression of the residual curves. So we would love to see you and help you with that. The Schroth method is great for that, but we have to take your spinal fusion into consideration as we're treating that. So make sure if you're not coming to see us at Align Therapy, maybe you don't have access to us here and you live further away, make sure you're finding someone who knows what they're doing with scoliosis correction surgery and kyphosis correction surgery. This is not just a one-level lumbar fusion in an adult that has degeneration. Even the adult scoliosis surgeries, these are multiple levels. These are more complex. And if you don't see these on a regular basis, they can be hard to know exactly what to do with them. So I encourage you to stay strong. I encourage you to stay flexible. I encourage you to stay active. And that will take you pretty far as this surgery and recovery goes. But I also suggest that you watch for those things that don't seem to be going away, because those things might happen. I'm not saying that they will for you, but if you have concerns over that, or you just want to get a better result and you want to get more strength and you want to get back to higher level activities, we're here for you. We can help you to know what to focus on, and while we protect that fusion. We want to protect the fusion. We don't want those segments above and below your fusion to wear out faster than they should. So we work on stabilizing those areas and increasing your function and stability. So hopefully this was helpful. Hopefully this video series was helpful and this protocol was helpful. And if you have questions, you can leave them in the comments for the video and I'll answer those. You can also call our office and even just talk to us with that. You can text us, you can email us, any way you want to contact us. And don't forget to subscribe to the channel. We'll do other video series that might be helpful for you, those that are further out from surgery, or those, maybe you're even watching this because you haven't had surgery yet and you're wondering what rehab looks like. So stay tuned and we'll have more information for you. Thanks for watching.